I'm so happy to share some information with you today. I am going to share my screen. Can everyone see my screen?
Yes.
Okay, thank you so much. Okay, so today I would like to share with you about some tips for daily living while you're living with Parkinson's disease and related condition. And what can occupational therapy do for you if you haven't encountered any occupational therapy or have seen an occupational therapist? Many of us may encounter some challenge in our activities of daily living. And to name a few, these are the commonly reported area: eating, grooming, dressing, toileting, bathing, cooking or meal preparation, home management, doing laundry, getting out or getting on the chair, sofa, toilet, getting in and out of the car. Sometimes it's moving along the bench. I have patients who told me that we love to used to go to diner. Now we still go from time to time, but I cannot sit at the bench anymore. I cannot even get onto the bench, right? Sleep or fatigue, work, shopping, leisure, and sports. Providing care for family, for those who may take care of grandchildren. And I also met a bunch of young onset Parkinson's individuals who actually take care of young family. Social life and participation, using a cell phone or a tablet or iPad, handwriting, time management. You know what? I need to change the way I put the audience. Okay, time management. So as you can see, I highlighted some of them: eating, dressing, sleep and fatigue, and handwriting, because these are among all of these are the even more commonly reported area. And we are going to touch on this area today. Okay. So if you have some trouble with eating or using utensils, it really depends on what the problems are. It could be different things. It could be different reasons behind them. Some of the most common problems are hand tremor, right? Shakiness. If that is the situation, you can try to stabilize your arm as much as possible. For example, when the whole arm or whole hand or whole wrist or forearm feel tremoring, at least if you stabilize some part of your upper limb, can actually help stabilize the rest of your hand. Not completely taking it away, but people find that that will help them gain some control. Sometimes trouble with holding the utensils because of muscle tightness in the hands. So we have a lot of muscles in our hands. Like I am talking about literally every single fingers. We have muscles around them. We have muscle tendons all over, from the forearm to the wrist, all the way to the fingertips. With Parkinson's disease, you might have developed some tightness in your hands. So you will need to do stretching exercise in your hands, all right? Sometimes people say, I feel weak. I actually feel, how come the utensils become so heavy? Apparently, those are the same utensils that you are using in the past 20 years, but it's because your hands get weaker. In that case, you might want to learn some strengthening in your hands. Sometimes people say, I cannot cut food. I don't know why the meats lately get so tough. Suddenly, globally, meats get tough, right? So it's also because your movement of cutting may have been a little deteriorating or may not be carry out some movement in cutting. Sometimes people say picking up food with a fork, the most commonly complained dishes would be eating a salad. They're like, the leaves don't want me to eat them. I just cannot pick them up, right? So it is movement related. And when you get to meet with a therapist working one-on-one, these are the things get evaluated, can really be educated. And the whole idea, if it is movement related, it is to really think about the intent of the movement. If I'm cutting food, most likely I should be sawing the food with the knife. If I'm picking up salad, the movement is properly stab and pick up. Of course, with so many participants here, each person has your own little problems, right? And probably cannot be addressed here in a support group. But when you get to see an occupational therapist individually, these are things can get evaluated and given you customized treatment plans. So in terms of like holding the utensils, a lot of patients tell me that they find that it's very helpful when they use built-up utensils. What are built-up handle utensils? You can see the picture right here with the colorful handles, and they have bigger handles, right? So these are built-up utensils, meaning that the handles are more fat, easily for you to hold on to it, to use a fork to stab and pick up, use a spoon to scoop, or use a knife to saw the food. Some people tell me that their hand tremor gets a little bit more stabilized when they use utensils that has a little bit weight in it. I personally have conflicting experience among most of my patients. Some people do say that I like that for a short period of time. I like to use the utensil that have the weight. But at the same time, I also met patients that they develop fatigue, especially for those who might have some muscular tightness and weakness. Then I won't recommend using weight utensils because that might be too heavy and then you don't enjoy your meal. So everyone is different. You need to get evaluated, eat in front of the therapist. I always at one point tell my patients, I would like you to bring in a typical meal to my clinic. I would like you to bring some leftover from last night's dinner so that I can actually see you eat. You and I are going to have lunch together, and then I'll schedule lunchtime for their meal time to really, for me to observe and evaluate their eating trouble. Another way to solve some of the problem is to kind of like compensate for it. For example, pre-cut food that already cut for you, right? Sometimes patients say, I really want to enjoy a steak in the restaurant, in the steakhouse, but the cutting is just too challenging. I don't really enjoy it. Do you know that you can ask the kitchen to cut your steak and then bring it out? Yeah, you can request that in the kitchen. They will cut it up and then bring it out for you, fresh. You can at home do more like a slow cooked meat. So meats are already very tender and fall apart, right? Another thing is you can actually eat fish. Fish is softer, it doesn't require much cutting, but more like a scoop it out. The most useful way is to be mindful about your movement. What are my troubles and what am I lacking in terms of movement? If cutting is a problem, think about sawing movement. I work with people with Parkinson's disease for over 10 years. And I find that whenever they complain about the cutting problem or the knives are not sharp anymore, it's because they are not sawing with their hands. They are just pressing. Pressing the meat is not going to cut the meat, right? Sawing the meat is to cut the meat. How come the fork is not picking up food? You push down and pick it up. The take-home message is mindful movement. There are some trauma-canceling utensils out there. Something on the right-hand side, this white choppy looking spoon is called liftware. So they advertise that they can like a counter the movement of the hands that is creating, and actually, you know, help stabilize when you use a utensil. Be honest with you, in the clinic, I try that on many patients. I am going to give you a very honest review. It is not helping more than helping among the patients that I try on. So it is up to you. It's a couple $100 a spoon, I have to say. Is it worth it? I really don't know, unless you go to an occupational therapist and try it out. Well, is chewing food or swallowing food become a problem? If that is the case, you really need a swallowing evaluation to see if that is the problem, because that will be a whole different ball game to tackle the problem. Another common area is getting dressed. Most of the complaints are, I have trouble putting on my over-the-head shirt, pull-over shirts. Somehow they get rolled up on my back. They are just stopping on my upper back, and then I cannot pull them down, like on my mid back, right? Did I gain weight? Or did my wife shrink my shirt? Come on, your wife washed your shirt for 30, 40 years. No way that she doesn't know how to wash your shirt and then shrink your shirt. Am I having a buttoning problem? I find that buttoning is very annoying, right? The pants button, right? That one button in the front, or sometimes it's the belt, just to put on the belt and the buckle of the belt. Is it shoelaces? Tying shoes become more difficult. Take a long time to get dressed. When I'm done getting dressed, I am exhausted. I don't want to go anymore. So, again, what the problems are require an assessment, right? To really see what the problems are, to provide you possible solutions. The most common problems are the change of posture. We are hunching over, the shoulders are forward, we put on an overhead shirt, and now the shirts get rolled up on my upper back and I'm hunching over, and then I feel I cannot really get the shirt down to pass my mid back, right? Now I need to straighten myself up, bring my chest out, bring my shoulders back to work on getting the shirt down. Is it the small arm movement and the small trunk movement? My body becomes very rigid, that I am not really moving spontaneously as I'm putting on a shirt. So things get stuck. So I just need to work on my movement to pull the shirts down while I have the optimal posture. It could be muscular rigidity, or the joints get very stiff, right? Fine motor movement that cause the problem of the buttoning and the pant button and the shoelaces. So when you get a chance to see an occupational therapist, if these are your problem, they really work on from stretching, fine motor coordination exercise, and last but not least, practicing putting on shirt, buttoning, tying shoelaces, the actual activities, right? To help you recalibrate your brain and your body and your movement to regain these skills that you used to have. Sometimes is it the balance problem? While I'm putting on a shirt or putting on pants, I feel I'm losing balance. In this case, I'll suggest perhaps you can just sit down to do it, right? Energy conservation. So if getting dressed can be very tiring, right? We need to work on having a more realistic plans. Well, perhaps you can save time by taking the clothes out last night so that right now the clothes are in front of you. You don't have to spend half of the energy running up and down, going to the dryer, going to here and there and look for the clothes, right? Or is it really the time to consider making my life easier by using some of the adaptive clothing and shoes? So as you can see in the picture on the right top corner, if you are looking at the same thing as me, that this is just a regular sneakers. It also has the shoelaces, just like normal sneakers with shoelaces. However, there's a zipper inside, right, on the side, so that you don't have to deal with shoelaces. And then some patients say, I really like wear shoes with shoelaces. That is my style, right? Their style is very important to look cool. So I say you can really get sneakers with shoelaces, but if you want to save the effort, you can really get something like that with a very subtle zippers inside, right? And then you see on the right-hand side, these pants, right, slacks, they look decent because I also have patients who tell me that don't tell me to wear sweatpants. I'm not a sweatpant guys. I totally accept that. I am with you. So there are clothes and or slacks, like good looking stuff that they actually have a fake button right here, right? In the front, there's a fake button. Whether you believe or not, I actually have a couple of pants have fake button. And then the side has elastics, right? So you pull them up and they still look good, but you don't have to deal with the buttons. Back to these shoes, not to advertise, I have no relationship with the company. It's called Friendly Shoes. It was owned and created by an occupational therapist after seeing so many patients suffer from the problem. This man decided to design shoes like that, and then he come up with a company. It's called Friendly Shoes. Does anyone have any questions before I move on? If you want to speak, you can unmute yourself and ask a question.
Yeah, there's that. Go ahead.
Okay, so if you can think of something later, you can ask at the end. Next, handwriting. The most common complaints of handwriting is my handwritings get very small, right? The medical term is called micrographia. Simply means small handwriting. Some people say they are not only small, they become illegible, right? So, you know, like these are some examples. And what are we going to do with it, right? So frustrating. We can actually practice big movement with handwriting. So I actually met someone who was a writer and who told me that I'm old school. I still like to write. I do start typing a lot, but if I can, I still like to write for my ideas, right? But it is really bothersome. She came to occupational therapy session. She told me, I know all of the other stuff. You don't have to teach me any of the ADL things. I really want to work on my handwriting to continue my writing. Okay, so after we did a lot of hand stretching exercise, arm stretching exercise, and then now we started to scribble very largely, right, on a very big notebook and drawing pad. And then after we do that, we shake it off. Now we start writing on a notebook that has lines, like on the right hand side, right here, like things that with papers or notebook that has lines. And while we do that, we learn to exaggerate our handwriting, meaning that usually I would write like that, but now I'm going to tell myself to write very big, bigger than normal, bigger than usual, bigger than how I would like it. Exaggerate your hand movement while you write, right? So she started to do that. At the beginning, it was slightly difficult. And then she pushed herself, go, 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 right? Now becomes a little too big, slightly uncomfortable, right? Okay, keep going, right? So she trained herself to be able to write big by exaggerating the size of the letters. And then as she continue on, the handwriting will get a little bit smaller. Now, when it gets a little bit smaller, then becomes more normal, right? So we spend some time back and forth, always start with hand stretching, large arm movement, big scribble, and then we start writing with intent, with exaggerated letter size. And over time, she was able to write very clearly and in normal sizes. But I'm going to say it needs some practice. Okay, so research study have told us that in order to make improvement in our handwriting, some tips we can do is to use lined paper whenever we can, right? And we can also consider using padded grip pen, right? So pen that actually has a bigger grip, or actually buy something that purposely for this purpose. You see the square picture on the right hand side, right? With a big grip holding, and then some patients find that that actually give them more control. My patients and I, like, they all know about it. My research participants, everyone, they know about the joke. I said, if you go to Chase Bank, ask them to give you a pen. When I go to Chase Bank, Chase is my bank, right? After I sign something, I'm like, can I keep your pen, please? Right? My patients love your pens. So they just have a comfortable, soft grip where you are holding, and then like you can actually write quite comfortably. Another way to solve the problem is do whatever you can to decrease the demands of handwriting, right? Like I understand that no matter what, we still need to write checks, right? So some people, they learn how to download the app in the from the bank, right? And do a little bit more electronic transaction, right? And some people tend to type more than write, right? And also do more credit cards, right? And so you know, there are ways to really improve the handwriting, but it takes a lot of practice. The little picture in the middle, you can see that it is the same person. on the left-hand side, that is the size of the right hand, and the right-hand side is the size of right hand. Is from the same person after practicing for 6 weeks. Any questions? Okay, I'll move on. Another commonly reported area is fatigue. More than 1/3 of people living with Parkinson's disease express that they experience some level of fatigue. Because of the fatigue or tiredness, they don't have the motivation to do the things that they think they should do, the neurologist told them to do, the therapist told them to do. So we really need to figure out what might cause the fatigue, right? How do you sleep? Perhaps sleep is a problem. Is it the sleep quality or sleep quantity? Not sleeping enough. I have patients who told me, I sleep so much, you have no idea. I'm lying in bed for 10 hours, but I don't feel well. Well, lying in bed for 10 hours doesn't mean that you have good quality of sleep, right? What might be the problems? What might be keeping you up? Everyone is different. Is it because you need to get up multiple times at night to go to the bathroom? Is it because your body becomes very rigid when your carbidopa levodopa might be wearing out, that now you become very immobile and uncomfortable and rigid, and then even giving you some body pain? Is it are you experiencing dystonia? I actually met multiple clients that they have dystonia, that their foot, one of their feet actually hurt so much, like cramping, giving them pain in the middle of the night. Is it insomnia, trouble falling asleep, or trouble maintaining sleep? Do you actually have sleep apnea, like a obstructive sleep apnea, that when you're sleeping, you don't even realize that you are not breathing, and then now you become lack of oxygen, right? And then your body is just like startling, jumping up, trying to take a deep breath, right? Really need to look into and think about if you have sleep problem, and something that you can talk to your neurologists. If it's necessary, have your neurologist refer you to another neurologist who specializes in sleep, right? A sleep doctor, right? If you have muscle rigidity, dystonia, that kind of problem, you can actually talk to your physical and your occupational therapist. There are some practical way to solve the problem. Cannot really cover everything here. Encourage you to talk to your therapist. How is it like during the daytime? If you have fatigue, make sure that you don't sit on the couch most of the time during the day. You need to move. The more you sit, the more tired you get. Research study told us that physical exercise can help improve the energy level. Research suggests us to do physical exercise, moderate to high intensity level 3 times a week. For people who don't really exercise, that sounds very, very hard, right? For people who do a little bit of exercise, yeah, I do some stretching. Yeah, I do a little bit of walking, 3 houses down and then come back down, right? Yeah, those are good movement, but maybe this is not enough. So you might want to join an exercise group. You might want to find a realistic way to add more physical exercise in your routine. Another thing is sleep hygiene habits. a lot of things that we do or we don't do may actually affect the quality of our sleep. Things such as drinking a lot of caffeine, right? I met people who come in for a 2 o'clock, 3 o'clock appointment with a tall cup of Starbucks coffee. So I'm like, I thought you said you're tired. He's like, exactly, I'm tired. I need my coffee to pick myself up. Otherwise, I cannot even come to this appointment. No, 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 right? So you have caffeine in your system. Now it's already 2, 3 o'clock. As we are older, it takes longer to metabolize the caffeine out of our body. Now the caffeine stay in your body for quite many hours. And now at night you are going to sleep, you are still under the effect of the caffeine. That will keep you up. That affects the quality of your sleep, right? Or am I watching television at night, lying in bed and fall asleep in front of the television? We call that blue lights or blue rays. That affects the brain waves. Even though when we are sleeping, you tell me, well, I fall asleep in front of TV, no problem. However, you fall asleep, you can fall asleep anytime, right? But to maintain a sleep in a calm way, the blue ray actually affects our brain waves. There are so many things that we are not even aware of us doing may actually affect our quality of sleep, our ability to maintain in deep sleep. Some simple, practical solution that I would suggest is try to remove electronic devices, television, at least half an hour before bedtime to do something else. Maybe read a book, do some gentle stretching exercise while you are in bed, just stretching your arms, your legs, your back. Meditation. I actually met with my research participants this morning, and then we actually did guided meditation together. So something that will really calm you down, help you relax, instead of doing other things that actually stimulate you. Try to get up and go to sleep around the same time every day, if possible. Even if you don't have plans to go anywhere, in the morning, open all the curtains, exposure to sunlight. That helps our circadian rhythm, right? Dehydration is a sign of fatigue. We forgot to drink. We are too busy to drink. We don't feel the sense of thirst. So drink more water during the day, the first half of the day. Cut out the water 3 hours before you go to sleep to avoid frequent nighttime urination. Okay, so there are lots of practical tips. Hard to really put that in your everyday lifestyle, but there are lots of things that, small things that we can improve, and you may feel a difference.
Ling, somebody in the chat
Yes.
put in, I have REM sleep behavior disorder. And 3 times in the last 10 days while sleeping, I've leapt out of bed, hitting my head, dreaming, resulting in bumps on the head and black eyes.
Yeah, that's very tough. Yeah, it's very, very tough, right? What put pillows, right, on the side, like just to minimize the bruises. Yeah, it is so very hard. Keep communicating with your neurologist, see what can be done in terms of medication management, especially for nighttime.
Thank you.
Any other thoughts and questions? If you haven't learned LSVT big exercise program, you should see a therapist and learn LSVT at one point. Exercise programs specifically designed for people with Parkinson's disease. It is focusing on exaggerated large movement amplitude to recalibrate your perception of movement, and hopefully over time doing this exercise can really help you understand what was the normal movement, how you used to move. Now, because of Parkinson's, things get smaller and stiffer and you don't realize that, right? So the exercise can really help not only loosen up your body, but in terms of centrally, it can help recalibrate how you perceive your movement in general. You can find a physical therapist or occupational therapist who knows the LSVT program. So fine motor is really another big topic. Before I attempt to get into another area, I want to ask one more time, does anyone have any questions?
Questions, anybody? It's a good time. Guess not yet. Okay.
Okay. So fine motor problems, as we mentioned earlier, muscles get tight, joints get stiff, hand exercise. So if you like, you can follow me and follow the picture, do some exercise, right? Start from the left on the screen. So open and close. Tight fists, big hands, tight fists, big hand, tight fists, big hand, tight fist, tight, I mean it, tight. Big hands, I mean it, not half hands, not 2/3 hands, full open hands, right? Stretch it all out. The picture in the middle is forearm rotation. Turn your forearm front and back. Okay, and then move on to the picture on the right-hand side with many hands, finger isolation, right? Fists, 1, 2, 3, 4, 5, pinky, thumb, peace, fists. 5. Okay. If you have therapy putty, you can also use a therapy putty to work on the strength of your fingers, right? If you want to see a therapist, your occupational therapist can be very specifically based on your needs to design like a therapy putty exercise for you. If you just, you can buy it in health store, online, therapy putty, and you can easily order it online. Squeezing, pulling, rubber band. Put a rubber band on your hands and then you stretch out your finger. Now we are working on the opposite side of the muscles. So for the therapy putty, you work on this side of the muscles. For the TheraBand, you stretch out the rubber band and you work on the other side of the finger muscle. There are just some more pictures to show you what you can do with the therapy putty for different grips, different pincers, we call that. And again, like I said, you can play with it however way you want it. If you want to know specifically what might be my biggest problem that I cannot do X, Y, and Z, right? A therapist will sit with you and actually do an evaluation and then prescribe the exact exercise for you. Like I said, you can easily order things on the company that start with the A, right? Online. And like they can be just therapy putty, can be a whole hand therapy kit with squeezing ball, with stretching bands, and all kinds of stuff. Gloria, maybe someone accidentally left and all right, anyway, I just admit someone. Okay.
I just admitted her, but she just came in.
Okay. All right. Okay. So big and fine movements, right? In general, in your everyday life, incorporate big movements in all fine motor movements and arm movement, walking, right? If you ever seen a physical therapist, they always say, take big steps, bigger steps, right? How come people keep coming in at 10 to 5? All right. Move with intent, meaning that it is hard, just like saying that movement with intention, right? This is what I plan to do. I am going to cut meat, so I need to really saw the meat, right? I'm going to put on clothes, then I'm really going to use big movement, long movement, and then pull my shirt down, push my arm through the sleeves and all that. I encourage you to see an occupational therapist to really learn about the intense and big movements, get evaluation, and understand what might be missing that makes life challenging. And whatever you learn, just keep practicing and things will get better.
Thank you.
Okay.
All right. Thank you so much. Thank you, Ling, so much. Why don't you stop the share and we'll see where people are at. Thank you, Ling, for all those really very specific. What I loved about this and the reason I asked Ling to come is that she's really good about giving us really specific behavioral intervention strategies, because you can learn a lot about a lot of the stuff. Some of it is, we've heard about, but to have strategies that really in a very concrete way allow us to react and intervene, make things a little better in our lives is the name of the game, I think. So thank you, Ling, for all those hot tips, I call them.
Thank you,
Gloria. Hot tips. So anyone have any specific questions about issues that you're confronting, behaviors you're dealing with that you're finding difficult that require maybe some interventions that you don't have? This is a good opportunity to be able to ask those questions.
I have a question.
Go ahead.
Yes.
It's about my mother. My sister and I are on here for my mother. She doesn't always, but often uses a wheelchair, but whatever chair she's sitting in, we've tried a ton of anti-thrust cushions. And no matter what, she consistently starts sliding down off the chair. Any suggestions for that?
Okay.
Ultimately, she'll end up falling off the chair.
Just keep sliding forward and then end up
Right.
like out, right?
Right.
So I don't know if her posture is fixed, right? If her posture is not fixed, so what we call
it's not fixed. In fact, she's able to sometimes get herself up. She just has to notice that she's slipping.
Okay. So there are a lot of trunk, we call that trunk, right? Your body, a lot of trunk weakness and muscle weakness in the pelvic area that causing, we call that posterior pelvic tilt, meaning that the pelvic, right? Your hip bone have a tendency to go this way. Is
Right.
because the muscles around it get a little weak. It doesn't stay the way that it's supposed to be. And also a little bit of curve back. And then it just form a tendency that the body really wants to go that way. And
Right.
then perhaps because she's not aware of it, and therefore she doesn't fix herself. If
Right.
the more she fixes herself, the more she is actually using her own muscles to
Right.
sit up, to fix herself and then sit more upright, right? So I would say if she is not, we call that fixed posture, meaning that unchangeable,
Yeah,
right?
no, it's not fixed, yes.
Okay. Then she really needs to go to see a physical therapist or an occupational therapist to really work on her posture. So we have different tools, different method. We call that mat exercise, like a mat, right? MAT. We call that mat exercise to really strengthen the pelvic area, to work on posture, to start engaging all those core muscles and gain more understanding how all those work together in order for me to sit upright so that I'm not sliding.
Right, right,
Because everything that we do, we need to sit up a little bit. Otherwise, if we are eating and then now I'm sliding and sliding and sliding, now I'm on the floor halfway eating, right?
right.
So she needs to see a therapist because
Yeah, she has one and they're good, but we'll mention that to them because she can't do anything on the mat, but she does exercises on her bed with them. So she could do something like that lying down on the bed.
Okay, yeah. Because
Okay.
otherwise, the first question I asked you if the posture is fixed is because if it's fixed, that means the therapist cannot really change her pelvic position and all that. Then that is a totally different direction.
Yeah.
Is that you need a special wheelchair that can tilt her up. But it doesn't sound like we are going that way. So I would suggest you to take her and really talk to the therapist and work on improving instead of compensating.
Okay, thank you very much.
You're welcome.
Great answer. Thank you. Okay, somebody else? It's a great question. Something going on with you that you need some assistance with, anybody?
Just a small detail. But now there are very popular shoes called Skechers and brands of Skechers. They're not only, I mean, that's just a brand that don't need any shoelaces. So
that's right.
I just wanted to mention that. I have a pair, but I said I don't have Parkinson's. But anyway, my husband does. I said, wait a minute, I don't want to lose that skill, so I don't use them very much. I like the idea of bending over and making my shoelaces, but anyway, if you can't do whatever. Anyway, Skechers.
The slip on, right? Like they even, you don't have to bend down to pull the back up. You push your foot in and then the back will just pop up. How awesome is that?
Very
anyway,
awesome.
Okay.
But I also think it's awesome that your husband is still saying, as long as I can do it, I want to try to do it. So there's that other side to it, which is we want to find compensatory strategies, but we also want to do it for as long as we can do it. So there is that balance there that I think is really important. That's the social worker and me talking.
Well, by Skechers that he has to tie his shoelaces and other colors or whatever of Skechers that he can just slip his foot in.
To do both.
Right. And
I have both.
Yeah, both.
Yeah, both. Yeah. I actually would suggest have both. On a good day, do the work. Don't lose the skill. On a bad day that you really don't feel like doing it, take the easy way. Don't get frustrated. Come on.
I like that.
That goes for everything.
It really does. It really does. Don't allow the frustration to take over because that doesn't help either. That's great. All right. Somebody else have something they would like to ask? Question. Go ahead, Nance.
I've been noticing that my fingers feel exceptionally tight. And my hands are always cold. So would the putty be the best way to try to stretch them out?
The putty is more for the strengthening. So it doesn't hurt, but I don't know if, I mean, it may loosen you up because you're squeezing something, and also increase blood circulation since you said your hands are cold, right? But the purpose is not really helping you stretch. Stretching is to
do that.
Stretch out, like opposite, right? Stretch out all the tendons and muscles and open up. The therapy putty is to increase blood circulation and the strengthening.
Okay, thank you.
Mm-hmm.
You know, it's very interesting. Again, it's my husband, but I'm going to just make a comment. At the pool, we do an exercise where you actually straighten your arm and then pull your fingers back, okay? And try and get each finger down in a downward. Yes, thank you. And then when we get finished with that, we do to grab the paw at that point and you move your arm back and forth. You sort of do a swift motion to keep flexibility, which I don't know why we're doing it in the pool, but I'm familiar with that. And I just mention it because it's another exercise besides doing this. You're doing, anyway.
So that is the wrists. So when you are doing this, you're actually stretching the wrists.
The wrist.
Right?
Okay.
Yeah,
Well,
yeah.
you start with your fingers.
This is the fingers, right? The hands, and then this is the wrists.
Okay.
Hi, I have a question, please.
Go ahead.
Yes.
Okay, sorry, I'm outside. I don't know if the wind is bothering you, but I'll make it quick. First of all, thank you. The information is very helpful. I'm the other sister to the sister that asked the question about the sliding down the chair. So while my mom is 87 years old and some of it can be, fatigue related, she noticeably has problems projecting her speech. So much so that if I'm sitting in front of her, it's almost a whisper and it's hard for her to speak. So the question is this Parkinson's related? Is this something that happens generally speaking? Or is it because she's so tired from the Parkinson's? And is there anything that really, I know they have singing courses and things like that, but is there anything that I can be doing or anyone who's with her can be doing to help her project her voice?
Okay. So Parkinson's affecting not only the big muscles that allow us to move, it is also affecting vocal cord muscles. It is also affecting face muscles. So when we say people may develop mask face, the face doesn't show much emotion, right? So that is affecting face muscles. Parkinson's affecting vocal cord muscles in this area that help us generate voice, right? So in that case, your mom is whispering because the vocal cord muscles become very weak. Earlier, one of the slides that I share with you is called LSVT, big movement exercise. The origin of LSVT is a voice treatment program. LSVT stands for Lee Silverman Voice Treatment, LSVT. Lee Silverman, a person who actually benefits from this voice program with Parkinson's, and then doing exercise to re-strengthen the vocal cord muscles. Because it's so successful, some therapists and neuroscientists use the same concept to develop LSVT, big movement, arm and legs. My suggestion for you is to take your mom to see a speech therapist who are LSVT certified, meaning that who has experience working with people with Parkinson's disease and know how to give LSVT voice exercise step by step to re-strengthen the vocal cord muscles. It is the weakness of vocal cord muscles.
Thank you so much. That was helpful. I appreciate it.
Okay.
Okay. All right. I'm going to take one last question and then we're going to wrap it up. Anybody else? One last question. This is your chance.
Hello?
Yes.
Oh, hi. This is Freddie King. Hi. My husband had been very reluctant to go to occupational therapy, especially in the beginning when he was diagnosed. So he went to PT, after I really bugged him. And then they told him to he did well and to stop doing that for a while. But he's kind of resistant to it, but he's having trouble with things like rolling over in bed and different, the dropping of things, the hand movements, and very frustrated by it. So I wanted to watch this today so I could get some ideas and just kind of present it to him that I think this could be helpful, without, telling him what to do.
Yeah. He needs to see an occupational therapist, and then so that they can see him doing it and what he's not doing. Like you really need to see that person in order to evaluate what are the troubles. I don't know what to tell you. Some people just don't believe that they can get help.
Right. But this was helpful to get some ideas, some concrete things, and encourage it. I mean, that's all that a care can do sometimes.
And we recorded it. I mean, I didn't even talk to you Ling about that, but I recorded it so that so if worst comes to worst, you can play it back to him and he might see it and recognize Ling's skill, because she obviously comes off very skilled, and that's, she's no quack. And that might also in itself be helpful, because it is something that I don't know that everyone really understands what occupational therapy is. Physical therapy is certainly much more, well known, and people understand it. People are not as familiar with OT, and I think that's important. They have to understand what they do, what she does. So, I don't know, Ling, any last thoughts?
So keep trying, keep working, keep focusing. Think about, why am I doing this? Why am I important? Why is it important for me to do X, Y, and Z, right? The reason behind it. Whenever you want to give up, whenever you feel I don't want to do it, I think about, is there any reason for me to keep pushing myself? And you can do it. Ask for help. Ask for help, definitely.
Thank you so much. Well, thank you, Ling, much for
Thank
you and your optimism and your expertise. Thank you. And I thank you all for coming out. And we hope to have more programming this summer in addition to our regular programming Thursday afternoon weekly PD discussion group for people with Parkinson's. I run a caregiver group every other week, Tuesday nights on Zoom. And of course, we have our fitness programs pretty much every day. So if anybody has any questions, feel free to reach out to me. All right, everyone, take care.
Thank you very much.
Have a
Thank
great
you.
week.
very much.
Thank you.
Bye.
Bye all.
Thank you.
Thanks. Bye-bye.
I think some people may have walked away.
I think some people are having trouble moving. I'm gonna remove these people.
Yeah.
I'll just remove them. Okay, there we go. That was
Okay.
that was wonderful.
Thank you.
No, really, it was really great. A lot of information. Wonderful. I really appreciate it. Oh, I should stop the share. I mean, stop the
That's the
recording.
recording.
There was something I should do. I will receive one. Are you sure you want to?